Breathe easy, full dose, fewer flares. That is the goal today. I am Alex. I used to help my mom manage asthma, and I remember the panic when doses did not seem to work. I also had my own season of shortness of breath. What helped me was learning the right dry powder inhaler steps and making simple checklists. I want you to feel that same calm. Here is the twist. A dry powder inhaler is not a spray puffer. There is no propellant, which is the spray gas. There is no spacer. You do not shake it. Health guides even say kids as young as 5 can learn it by breathing in sharply. Drug inserts say you do not need to shake this kind of inhaler. Research also shows about 3/4 of older adults may struggle to inhale hard enough, but practice and good coaching make a big difference. Quick tip right up front, a dry powder inhaler needs a fast, deep inhale, not a slow, gentle breath. Safety note, this video is education only. If you have severe trouble breathing, blue lips, chest pain, or you feel faint, get urgent care. Which feels easier for you, a dry powder inhaler or a regular spray puffer? I am curious. Next, what makes a dry powder inhaler truly different? Here is a simple truth I wish I knew sooner. Our dry powder inhaler may look like a puffer, but it is not one. It has no spray. No gas pushes the medicine out. Your breath is the engine. That is why the technique changes. So what is inside powder? When you breathe in fast and deep through the mouthpiece, the airflow pulls the powder into your lungs. Health articles even say all you need to do is breathe in sharply. That is why even young kids can learn this with coaching. But if you're older, you might notice it is harder to pull strongly. Studies estimate about 3/4 of older users do not generate enough flow on the first try. That is common, and it is solvable with practice. 2 quick differences to lock in. No spacer for a dry powder inhaler, and no shaking. A drug insert literally says you do not need to shake this kind of inhaler. Keep that in mind. We know the why. Now let us start the how. Step 1 is loading the dose so the medicine is ready. Your inhaler has medicine inside, but it is not ready yet. We need to load a dose. Think of it as arming the device so your next inhale can pick up the powder. Different devices load in different ways. Diskus, said Diskus, has a thumb grip. Push the cover open, then slide the lever down until it clicks. That click means the dose is loaded. Ellipta, said Ellipta, loads when you slide the cover down until it clicks. The counter drops by 1 when it is ready. Do not open and close it over and over or you will waste a dose. HandiHaler, said HandiHaler, uses a capsule. Open it, drop 1 capsule into the center chamber, close the mouthpiece until it clicks, then press and release the green button 1 time to pierce the capsule. The dose is ready. Always glance at the dose counter if your device has one. With Diskus, you start with about 60 doses and the last 5 show red. On Ellipta, the number steps down when you load. If the counter does not change, a dose did not load. Dose ready. Next, we set up the breath. We exhale away from the device. Dose is loaded. Now do one thing that saves a lot of frustration. Breathe out fully, away from the inhaler, not into it. Hold the device away from your mouth and exhale into the room first. Why away? Moisture from your breath or saliva can clump the dry powder and block it. Every guide warns, do not breathe out into the mouthpiece. Keeping the inside dry keeps the dose free to move. There is another reason. When you empty your lungs first, your next breath can be big and strong. That strong pull is what carries the powder deep into your airways. Here is my quick checklist. Stand tall or sit up straight. Hold the inhaler level and steady. Look at the mouthpiece to make sure it is clear. Exhale fully into the air away from the device. Try not to cough into it or talk over it. Lungs empty, device dry. Great. Now we take the breath that makes a dry powder inhaler work. A fast, deep inhale through your mouth. You just exhaled fully. Now comes the make it or break it moment. Breathe in quickly and deeply through your mouth, not through your nose. Think of drinking air through a big straw. 1 smooth, strong pull. Instructions say take 1 long, steady, deep breath in. Training videos add breathe in quickly and deeply. The speed matters because there is no spray. Your fast inhale creates a swirl of air that lifts the powder and breaks it into tiny particles. That is how it reaches your lungs. If this is hard, you are not alone. Research shows about 3/4 of older adults struggle to inhale forcefully enough at first. Practice helps. Try a few dry runs without medicine to feel the speed. Sip through your mouth like a strong slurp. Keep your tongue flat so it does not block the flow. If a fast inhale is tough for you or a loved one, a portable mesh nebulizer can be helpful. TruNeb makes a small kit that turns medicine into a fine mist, no hard inhale needed, and they accept HSA and FSA cards. If that fits your plan from your clinician, check the link in the description to learn more. You pulled the powder in, now we lock it in place. Hold your breath for a few seconds. You inhaled. Do not blow it out yet. Hold your breath. Aim for about 10 seconds or as long as you comfortably can. Even a shorter hold of 3 to 4 seconds helps. The hold lets the tiny particles settle on your airways instead of floating back out. Here is how I do it. Remove the mouthpiece from your lips. Close your mouth. Count to 10 slowly in your head. Keep your shoulders relaxed. Then exhale gently away from the device. If your medicine is a corticosteroid, said corticosteroid, rinse your mouth with water and spit after you finish. That helps prevent mouth soreness or thrush. One more note that confuses a lot of people. You may not taste or feel anything even when you did every step right. Many dry powder inhalers are silent. If you loaded, inhaled fast and deep, and held your breath, the dose likely went in. Do not take a second dose just because you did not taste it. Great. The core steps are set. Now let me show you those steps on real devices, starting with a Diskus. Meet Diskus, also called Accuhaler. Hold it level with the mouthpiece facing you. Place your thumb on the thumb grip and push it open. Now slide the side lever all the way until it clicks. That click means the dose is ready. Keep Diskus flat so the powder stays where it should. Next, exhale fully away from the mouthpiece. Seal your lips around it. Breathe in fast and deep through your mouth. Remove the inhaler. Hold your breath for about 10 seconds or as long as you comfortably can. Then exhale slowly away. Close Diskus by flipping the cover back. Check the dose counter. It starts around 60. It counts down by 1 each time. The last 5 show red so you know to refill soon. If this demo helps, please subscribe to Breathe Better with Alex for simple, step-by-step breathing tips. And tap like so more people can find this. It supports the channel and it might help someone avoid a flare. Diskus done CSI accepting. Up next, the Ellipta device. It loads with a cover, not a lever. This one is Ellipta, said Ellipta. Hold it upright. Slide the cover down fully until you hear a click. That click loads 1 dose, and the counter drops by 1. Do not open and close it more than you need, or you can waste a dose. Now, the breath steps. Hold Ellipta away and breathe out fully into the air. Do not breathe out into the mouthpiece. Seal your lips around the mouthpiece. Take 1 long, steady, deep inhale through your mouth. Do not breathe in through your nose. Remove the inhaler and hold your breath for 3 to 4 seconds, or longer if you can. Then exhale slowly away. You may not taste or feel anything, even when it worked. That is normal. Do not take another dose if you do not feel a taste. If needed, wipe the mouthpiece gently with a dry tissue. Keep water away from the inside. Slide the cover up to close it and keep it clean. Ellipta, done. Now let us try a capsule-style device called HandiHaler. Now for HandiHaler, said HandiHaler. This one uses a small capsule. First, open the cap and mouthpiece. Drop 1 capsule into the center chamber. Do not put it in the mouthpiece. Close the mouthpiece until it clicks. Press and release the green side button 1 time to pierce the capsule. That click means the dose is ready. Do not pierce it twice. Exhale fully away from the device. Seal your lips around the mouthpiece. Breathe in quickly and deeply through your mouth. You should hear the capsule rattle or vibrate as the powder releases. Remove the inhaler. Hold your breath for up to 10 seconds or as long as comfortable. Then exhale slowly away. To make sure you empty the capsule, inhale a second time the same way. Many guides suggest 2 inhales for this device so you get the full dose. After that, open the mouthpiece and discard the empty capsule. Close the cap for next time. If you did not hear the rattle, the capsule may be stuck. Open it, tap the base to free the capsule, close it, and try again. Final demo next, Turbuhaler. Last device today, Turbuhaler, said Turbuhaler. Take off the cap and hold it upright. Twist the base 1 full turn in one direction, then twist it back until you hear a click. That click loads the dose. Keep it upright while you twist, so the powder stays in place. Now the breathing steps you know. Hold it away and breathe out fully into the air. Do not blow into the device. Seal your lips around the mouthpiece. Inhale quickly and deeply through your mouth. Remove the device and hold your breath about 10 seconds if you can. Then exhale slowly away. Recap the Turbuhaler to keep it clean and dry. You may not hear any whistle. That is normal. Many dry powder inhalers are silent. Trust your steps. Load. Exhale away, inhale fast and deep, hold close. That sequence is what gets the medicine where it needs to go. We have covered all the devices. One more important part remains: care, storage, and simple fixes. You are almost done. Caring for your device keeps doses reliable. After you use it, wipe the mouthpiece with the dry tissue. Do not wash the inside with water. Moisture makes the powder clump and can block delivery. Store your inhaler in a cool, dry place. Avoid steam, bathrooms, and hot cars. Check the dose counter if your device has one. When the counter turns red or reaches zero, plan a refill. On some devices, if the counter didn't move when you loaded, that means no dose was delivered. Try again or ask a pharmacist. No taste, no whistle. That can still be a correct dose. If you followed the steps, do not take an extra dose just because you did not feel something. If you cough right after inhaling, it often still works if the dose was loaded. If your medicine is a corticosteroid, rinse your mouth with water and spit. This video is education only. If your breathing is getting worse, your rescue plan is not helping, or you have blue lips, chest pain, or confusion, seek urgent care. Quick recap next. We covered the real steps today. Load the dose, exhale away, inhale fast and deep. Hold your breath. Close it, clean it, and store it dry. You saw Diskus, Ellipta, HandiHaler, and Turbuhaler in action. Now you know what that clean click means, why you never blow into the device, and why no taste still counts as success. Remember, dry powder inhalers are quiet tools. The medicine is a powder, not a spray. When you use steady, simple steps, you get your full dose and fewer flare-ups. Keep a short checklist on your phone or on the inhaler case. It helps under stress. If you found this helpful, subscribe to Breathe Better with Alex and share this with someone who uses a dry powder inhaler. And always check with your clinician or pharmacist for personal guidance. Thanks for watching. Your turn now. What will you do differently the next time you use your dry powder inhaler? Maybe exhale first, inhale faster, or hold longer. I am cheering for you.